Good afternoon. Today we will discuss about anatomy of the uterus. So anatomy of the uterus definition: it is a hollow, thick-walled, fibromuscular female reproductive organ. So it is situated in the pelvis between the urinary bladder and rectum behind. So relations of the uterus, you can see this is the uterus, and anteriorly we have urinary bladder, and laterally uterus has ovaries. Measurements in non-pregnant women, the measurements of, so the length is 6 centimeters from cervical canal to uterine cavity, and thickness is 2.5 centimeters, and measuring about 40 grams, and length is about 7.5 centimeters. So development of the uterus. Uterus develops from the Mullerian ducts. Fundus and upper part of the body developed from the intermediate horizontal part of the Mullerian duct. And lower part of the body and cervix developed from uterovaginal canal, and the caudal vertical part of the Mullerian duct of the two sides fused to form the uterovaginal canal. So the uterus has been divided into three following parts. First one is fundus. This one is the fundus. This is the body of body of the uterus, and this is cervix. You can see in the image. Let's discuss about fundus of the uterus. This is the fundus of the uterus, and it is the dome shaped mobile part. Mobile part means freely movable part. Relations of the fundus of the uterus: it is covered by the peritoneum along its whole extent. Visceral relations: small intestine and sigmoid colon occasionally. Let's see the body of uterus. The body of the uterus has two surfaces. First one is anterior surface or visceral surface, vesical surface, posterior surface or intestinal surface. So relations of the body of the uterus, you can see in the image. See relations of the body of the uterus. Anterior inferior surface. This is the anterior inferior surface. See, you can see the uterus here. This is the anterior part, and this is the inferior part. We have uterovesical pouch. See, you can see the uterovesical pouch. So relations of the body of the uterus: anterior inferiorly it has uterovesical pouch, and superior surface of the urinary bladder. You can see here, this is the urinary bladder, and this is the superior surface of the urinary bladder. So relations of the body of the body of the uterus: we have superior surface of the urinary bladder. And let's see the posterior relations of the body of the uterus. Rectouterine pouch. You can see the rectouterine pouch here, and a sigmoid colon. See sigmoid colon. See, we are discussing about the posterior relations of the body of the uterus. We have sigmoid colon here, and we have rectouterine pouch here, and loops of the small intestine. These three are the relations of posterior surface of the uterus. So let's discuss about cervix of the uterus. So it is the lower fixed part of the uterus, and it is the cylindrical in shape, and it extends internally from the internal os and externally to the external os. Cervix lower one third of the organ separated from the body by the constricted part is called isthmus. Cervix is divided into two parts. First one is supravaginal part and vaginal part. Supravaginal part is the upper half, and vaginal part which opens into the vagina is called vaginal part. Let's discuss the blood supply to the uterus. So the blood supply of the uterus is primarily it supplies two arteries. First one is uterine artery and second one is ovarian artery. See, uterine artery it is the main supply. It is the branch of anterior division of the internal iliac artery, and ovarian artery it is the branch of the abdominal aorta. Let's discuss the uterine artery. So uterine it is the branch of the internal iliac artery, and it supplies uterus, medial 3/4 of the fallopian tube, and as well as vagina. Venous drainage by uterine vein and ovarian vein. And nerve supply sympathetic, it has both sympathetic and parasympathetic. Sympathetic nerve supply from thoracic 12 to lumbar 1 segments of spinal cord via hypogastric and ovarian plexuses. Parasympathetic nerve supply from S2 to S4, that is sacral 2 to sacral 4 segments of the spinal cord via the pelvic nerves. Clinical anatomy. So clinical anatomy is very much important. Here there is the ligaments which support the uterus during labor or childbirth. If McEnroe's ligaments are lacerated during childbirth and not properly repaired, the uterus may descend through the vagina. This condition is known as uterocele or prolapse. These ligaments are also known as cardinal ligaments or transverse cervical ligament. And another clinical anatomy we have here is retroverted and retroflexed uterus. So uterus is retroverted if the uterus is bent backward on the vagina. See, you can see here. This is the normal uterus. Normal uterus is antiverted and antiflexed uterus. These are the retroverted and retroflexed uterus. This condition happens if the uterus is bent backwards on vagina. So this causes prolapse of the uterus. Okay. And these are the changes of uterus during pregnancy. The uterus becomes greatly enlarged. The increased wall thickness is mainly due to the hypertrophy of the uterus. As the pregnancy proceeds, at the fourth month, the uterus palpable above the symphysis pubis. At fifth month, it reaches the umbilicus midway between the umbilicus and symphysis pubis. At sixth month, it reaches level of umbilicus, and at the eighth month near the xiphisternal joint. At the ninth month, it extends long up to the xiphoid process of the sternum. Thank you.